Are you dealing with knee pain and want to know what's going on? I'm Dr. Jared Wadsworth here at Uintah Spinal Health, and I want to show you the part 1 of 2 videos of what we do to evaluate and treat knee pain. So in this video, I'm going to go through a brief evaluation of treating knee pain and what we're looking at. As you see, we're going through several body movements. We're going through a full body screen of how we're moving from head to toe first, and then we can evaluate it more in detail of the knee later. We're going to have how well you squat, how well you bend forward, backwards, rotate. We're going to look into how well your ankle can move, dorsiflect, bend forward in the ankle. That takes a lot of pressure off the knee. If you can't bend your ankle very well, then your knee takes the brunt of it. Also, we'll look at the hip. The big thing about the knee that we see is that if there's knee pain, that's not a direct trauma to it. A lot of it is because it's being overworked, because it's doing the job for its knee and the job for a hip or the ankle. If the hip and ankle don't move very well, then the knee takes the brunt of it because it's trying to make up for it. So that's when we see just knee pain that kind of gradually comes on, or even some minor meniscus tears or some tears like that. We'll also go through some orthopedic tests, checking the meniscus with these orthopedic tests, checking the ligaments, the ACL, PCL, LCL, MCL. Do these orthopedic tests to make sure we're not going to miss anything. If we do, then we'll refer out to the orthopedic specialist in these field to get a second opinion on it for the people that we work with. So we'll check range of motions of the hip, knee, and ankle, and then strength and stability of those joints as well. We'll check glute strength, glute stability. If you are using your glutes to raise your leg, or if you're using your back muscles, you want to get more glute muscles to do that. When you do a bridge, you want to check the glute activity with the bridge. You want to make sure it's all glute, no hamstring, and no back to lift your back up when you're doing a bridge movement. We'll just check individual legs, both together and individually. Again, we want to make sure it's more of a glute exercise for you, not a hamstring or back. If it's that, then we want to activate the glutes so the glutes do the job. And here we're just doing some simple muscle testing of the hip, knee, and now the ankle. Make sure we got some good strength there. Just some nerve testing as well. This is a brief evaluation of the knee. When something brings down pain, we'll go more in depth of what's actually causing that pain and try to dive deeper into it. We're trying to touch all the points to get a brief overview and then dive deeper from there. Stay tuned for part 2 where we will go over treatment and rehab for it.